Have you ever heard of the side effects of drugs? Yeah? Well, have you ever heard of the adverse effects of drugs? What's the difference? This is what we're going to find out in today's video. So stay tuned. Hello everyone again and welcome to my channel. If you are new to this channel, my name is Ahmed and I'm a fourth year medical student at the Medical University of Plymouth. Today we're going to speak about the adverse drug reactions. What are they? What's the difference between it and the side effects? And what are the different types of the adverse drug reactions? So let's get started. Okay, so let's start with the side effect. What is a side effect? A side effect is a secondary, unintended effect of a drug. Let's take as an example aspirin. Aspirin is given as an analgesic. So analgesics are pain relievers. So if you are giving the aspirin as an analgesic for a patient and this patient have side effect, which is, let's say for example, antiplatelets. The aspirin can act as an antiplatelet. So this is one of the side effects of aspirin, which is not necessarily bad. So in this case, we call this a side effect because it's not necessarily bad. So we can actually use aspirin as an antiplatelet with some other patients, which can be used as a primary or even secondary prevention medicine for cardiovascular disease. Now, what is the adverse drug reactions or adverse drug effect? Now, the adverse drug effect is an unwanted, non-beneficial side effect. Okay, so as we said, adverse drug effect is always bad, always non-beneficial for the patients. Now, I want you to know something, that there's no drug or medication in this whole planet that have no side effects or no adverse effect. Every drug, every medication in this planet have some side effects and have some adverse effects. So keep this in mind. Now, let's see the classifications of the adverse drug reactions. In the big books, there is two main types of the adverse drug reactions. There is type A and a type B. Let's have a look on type A. So, to better understand the type A adverse drug reactions, let's go back to the aspirin example. I love aspirin. So, aspirin, if it's taken for a long time, so let's say a patient is taking aspirin for a long time, HCl will increase, blood aggregation will decrease, platelets would stop forming, so decreases the formation of the platelets. Now, you as a physician or as a pharmacist, don't you know about these side effects? You probably do. So it is an expected side effect. It is also common, but it usually comes with the long usage of the drug. So it's a cumulative effect of a drug. Plus, it is also dose related. So chances are, the higher the dose, the higher the probability that the patient will face these side effects. Now, how can we solve this issue? Simply, we just adjust the dosage of the drug in which we prevent these side effects from occurring. Now, let's go to type B. Okay, now let's have a look on the type B. Type B is called the bizarre type. Bizarre meaning random. Oh, by the way, type A is also known as the augmented type. Augmented meaning it's due to the accumulative drug effect. Anyways, let's go back to type B. Type B, to better understand, we also have a quick example. Now, there is a drug called the succinylcholine. Succinylcholine is usually used in surgeries to produce muscle relaxation. Now, most of the people have no issues with this drug. But there will be one patient who will surprise you by having an enzyme deficiency, which is the pseudocholinesterase enzyme deficiency. In this patient, there will be a very big adverse effect. So instead of this drug producing muscle relaxation, it's going to produce muscle paralysis. So another example, another very easy example is penicillin. Penicillin is given widely to everyone and most of the people have no issues with it.
but there will also be a patient where they have hypersensitivity to penicillin. Now, let's talk about the mutagenesis. What is immutogenesis? Immutogenesis is the process by which a person's DNA change, which causes gene mutation. So it's change in the chemistry of the gene. Now, I want you to know something. 2 to 3% of all the newborns have birth defects. Now, that's a high number for birth defects. But the majority of these 2 to 3% actually are caused by drugs. So, example of these drugs can be the anti-cancer drugs. So, anti-cancer drugs can actually promote for miscarriage, and it increases the risk of birth defects. So, have this in mind. Now, there are some drugs which promote for cancer formation. So, for example, tobacco, chemotherapy, even hormones such as estrogen. Let's say there is a pregnant woman, and this pregnant woman starts taking estrogen treatment, and she gives birth to a daughter. After 20, 15, 17 years, this daughter would have adenocarcinoma in the vagina. Why? Due to the mother taking estrogen when she was pregnant 15 to 20 years ago. So this is an important thing to keep in mind, that these drugs which cause cancer, which is called the carcinogenic drugs, they don't have to be immediate, right? They can be inside us. So the effects of these drugs can be shown later after so many years. Now let's go and see the teratogenicity. Okay, now let's talk about the teratogenicity. Teratogenicity is basically the study of the drug effects on the fetus and the fetal development. Now, to better understand it, we divide the pregnancy into stages. Now, normal pregnancy is around 38 to 40 weeks. The first stage is called the implantation stage, and it's between the first and the third week of pregnancy. Now, due to the early stage of pregnancy, the women don't actually know they are pregnant. So they might be taking some drugs already. In this stage, there is a rule called all or none. This rule, what it means is that either the drug that the woman is taking kills the fetus, so the woman have miscarriage, or it does nothing at all. This is the first stage. Okay, so the second stage of the pregnancy is called the first trimester, which is from the 3rd till 12th week of pregnancy, which is the first 3 months. Now, this is the most risky stage, as the fetus is undergoing the organogenesis, which is the organ formation of the fetus. Now, women pregnant in this stage should not be taking any drugs whatsoever, because any interference of any drug with the organogenesis would create the congenital anomalies. So the children will be born with congenital anomalies and birth defects. The third and final stage of pregnancy is known as the late stage. This is after the first trimester, so after 3 months till the end of the pregnancy. Now, in this stage, it's a little bit less risky for the pregnant woman to take drugs, yet it's not 100% safe. Why? Because still in this late stage, there are some organs being formed and getting developed, such as the gonads, CNS and brain, etc. Now, these are the 3 stages of the pregnancy. And I want to give you some examples on the teratogenic drugs. I'll give you 2. The first is the antithyroid drugs. Antithyroid drugs can cause fetal goiter and hypothyroidism. Second is the tetracyclines. Tetracyclines can cause bone deformities and permanent discoloration of the teeth. So these are some examples of the teratogenic drugs. So guys, that was everything for today. If you found this video useful, if you enjoyed it, please hit the like button down below Subscribe to my channel to get my videos as soon as it get released. Till next time, stay safe.